What kind of leadership is needed to move and really be successful or move the transformation of healthcare? Is it a governor? Is it key constituents?
We had our governor leading. He took a break. We had key legislators actually step up to lead in that time period. And we had a director at the time of our state agency who was willing to take risks and lead as well. And so I would say, having learned our lesson, I would not put all of my eggs in one leadership basket. Okay. But I think that you do need a handful of people who are willing to step up and take on an incredibly entrenched and powerful industry. And so spread it around.
Which I think is absolutely fundamental, and it goes to the points that have already been made here today, is the importance of relationships. Peter Pronovost, who is, many of you may know, is from Hopkins and does lots of work in quality improvement, says that change happens at the speed of trust. And so it is an essential part of leadership, in my view, to be trustworthy. And that means a willingness to listen, a willingness to hear all sides in an argument, and a willingness to bring divergent views together. And I would say that, in my mind, particularly when you're dealing with interests that are entrenched, change is very difficult to do. It is an essential thing to build that level of trust across the provider community, the payer community, public sector, the business community, and consumer groups.
The relationship between those is as important as any individual leader, and some degree of shared kind of core belief that you might disagree about 1,000 details between here and the end point, but you're all looking at the same end point in some kind of central way, almost almost a religious belief that I'm
get there.
We are going there, and so while we might have a little phrase, we're all trying to get to the same place.
And did those leaders come with that, or is there a way of helping people get to that central kind of vision, keep the eye on the prize? They automatically come to the table going, that's where we want to get, or is there something that really helps shift them?
In my experience, what leaders who are smart about how messed up the system is now, and who are given good support in terms of understanding proposed changes and why they're going to make it better, go there. They don't. Most leaders don't get into the deep depths of the details.